Video 61, Health Literacy and Numeracy Area 6, Chess Sub-Competencies 6.1.1. Review the learning objectives for this video. Welcome to this video on health literacy and health numeracy. I am so glad you are here because understanding these two concepts is going to make you a stronger, more effective health educator. Let us start with our definitions. Health literacy refers to an individual's capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. This definition comes directly from the Institute of Medicine. Health numeracy is a closely related but distinct concept that you will also want to know well. It refers to a person's ability to interpret and act on numerical information in a health context. This includes things like understanding medication dosages, interpreting nutrition labels, calculating insurance copays, and making sense of risk statistics such as 1 in 10,000. Now here's why this matters to you personally as a health educator. Research consistently shows that over 1/3 of adults in the United States have limited health literacy. That means roughly 89 million Americans struggle to understand basic health information. When you create educational materials, brochures, informed consent documents, or website content, you must write at a level your audience can actually comprehend. The widely accepted target is a 6th to 8th grade reading level, and here is something really important to keep in mind. Writing at this level does not mean dumbing down your content. It means being clear, direct, and intentional with your word choices so that the maximum number of people can benefit from the information you provide. That is a skill you should feel proud to develop. The consequences of ignoring health literacy are significant. Patients with low health literacy are more likely to be hospitalized, less likely to follow medication instructions correctly, and more likely to experience poor health outcomes overall. As a health educator, you have a professional obligation to ensure your materials are accessible to the populations you serve, and the fact that you are learning this now puts you in a great position to do exactly that. Now let us walk through one of the most commonly tested readability formulas on the chess exam, and I want you to feel really confident with this one by the time we are done. The SMOG index, which stands for Simple Measure of Gobbledygook, was developed by G. Harry McLaughlin in 1969. It is considered the gold standard for health education materials because it predicts 100% comprehension at the grade level it identifies, unlike some other formulas that predict only 50% comprehension. Here is how you calculate SMOG step by step, and you are going to find this is very manageable once you practice it. First, you select 30 sentences from your document. You take 10 from the beginning, 10 from the middle, and 10 from the end. This sampling method ensures you are evaluating the full range of content complexity. Second, you count every polysyllabic word in those 30 sentences. A polysyllabic word is any word that has 3 or more syllables. For example, the word understand has 3 syllables, so it would be counted. Third, you take the square root of the total polysyllabic word count. If you counted 36 polysyllabic words, the square root would be 6. Fourth and finally, you add 3 to that square root. In our example, 6 plus 3 gives you a SMOG grade level of 9, meaning the document requires a 9th grade reading level. If your health education materials score above an 8th grade level, you need to revise them by replacing long words with shorter synonyms and breaking complex sentences into simpler ones. You have got this. Once you work through a couple of practice examples, this formula will feel like second nature to you. The second readability formula you should know for the exam is the Fry readability graph, developed by Edward Fry. Unlike the SMOG index, which uses a mathematical formula, the Fry method uses a visual graph, and some of you may actually find this approach more intuitive. Here's how it works. You select 3 100-word passages from your document. For each passage, you count the total number of syllables and the total number of sentences. Then you average the syllable counts and average the sentence counts across all 3 passages. You plot these two averages on the Fry graph, which has average syllables per 100 words on the horizontal axis and average sentences per 100 words on the vertical axis. The point where these two values intersect on the graph indicates the estimated reading grade level of your material. The Fry graph is particularly useful when you want a quick visual estimate and can be applied to materials in multiple languages with some adaptation. Now, beyond formulas, you also need to understand plain language principles, and this is where your work really starts making a difference for your audience. Plain language means writing in a way that your audience can understand the first time they read it. The key strategies include using short sentences of 15 words or fewer, choosing common everyday words instead of medical jargon, writing in active voice rather than passive voice, and organizing content with clear headers, bullet points, and generous white space. For example, instead of writing, "The patient should be advised regarding the contraindications of this medication," you would write, "Tell the patient about the side effects of this medicine." Both say the same thing, but one is accessible to far more people. As a health educator, your ability to apply these readability tools and plain language strategies directly impacts how effectively your audience receives and acts on health information. You are building skills right now that will genuinely help the communities you serve, and that is something to feel great about. Read the scenario stem aloud. Give students 30 seconds to consider options before advancing. The correct answer is C. A SMOG score of 11 means the brochure requires an 11th grade reading level, which far exceeds the recommended 6th to 8th grade target for health materials. The correct action is to revise by simplifying vocabulary and sentence structure. Option A ignores the literacy mismatch. Option B would increase the reading level further. Option D removes important health numeracy content rather than making it more accessible. Summarize the key takeaways.